Hi, this is Marissa from the ER. We're transferring a patient to your floor. She's stable and suffering partial and thickness burns, about 9%. She came in by ambulance and she's with her mother. Her mother doesn't speak English. Okay, thank you.
Okay, Jasmine, so we have a new admit in room 3. She's a 20-year-old female with full thickness and partial thickness burns. So we're going to go assess her in a couple minutes.
Okay.
Okay, so let's go meet our patient and do a quick assessment of her burns. Hello, Miss Fawn.
Hello.
How are you?
Not so good.
Oh. Well, I understand you had some burns on your arm. Oh, okay. We'll assess that later. Well, I'm Isabel. I'll be your nurse today. And this is Jasmine. This is a student nurse. Oh. Is this your mom?
Yeah.
Oh, okay. Does she? Oh, okay. Well, we're gonna have to have an interpreter, maybe help her understand what's going on. But I'm gonna explain to you what's going on. Alright, so let's take a look at her burns, Jasmine. So what kind of burn is this one? Do you know?
This is a superficial partial thickness burn. It goes through 1/3 of the epidermis and 1/3 through the top of the dermis. It'll be pink to red in color, mildly swollen. It'll be blistering, moist, and blanches when you apply pressure. It's painful, but it'll heal in a few weeks.
Okay, good. That's good. You've been doing your homework. And
It'll
That-
heal in a few weeks.
and how about this burn right here? Okay, Jasmine, so what kind of burn is this right here?
This is a deep partial thickness burn. It goes through 2/3 of the dermis. It'll be red in color, dry with white areas. It'll have moderate swelling and severe pain. And because of the burnt blood vessels, there's no blistering. And it'll take longer, about 2 to maybe 6 weeks to heal.
Okay, good. So since the ER has stabilized our patient, she's now transferred to the med-surg unit to manage her burns and help her heal. Our priority now is to maintain a patent airway and administer high concentration humidified oxygen to any patient with severe burns. Now we also need to provide fluid resuscitation and pain management, so you have IV fluid running from there. Prompt initiation of IV therapy is essential to prevent long-term complications such as burn shock and renal failure. The Parkland-Baxter formula is used to figure out how much IV fluid a patient can receive, which factors in their body weight and the percentage that the body is burned. So in her case, it's 9% because it's her arm. A large bore catheter is preferred so the fluid comes in quicker. Sedation may also be considered a priority. It is recommended that a patient with large burns be given IV analgesia. We must also assess her periphery pulses frequently and elevate the burned limb above the patient's heart if it's possible, or if she can tolerate the pain. We also need to prevent further tissue injury and infection. Infection is a major complication of burns due to impaired resistance from disruption of skin's mechanical integrity and generalized immune suppression.
Hi, Mrs. Vaughn.
Hello.
Oh, I'm Dr. Rufo, and I'm here to check up on you and make sure that you're understanding your treatment plan.
I don't know, Mom.
So during healing, we are preventing further tissue loss and preventing infection, and we're trying to make it as painless as possible for you. And as long as you keep avoiding smoking and keep up with proper nutrition, you should heal with 2 to 6 weeks for your partial thickness burns, and full thickness burns will require grafting and might take months to heal.
醫生，你有冇睇見我個女嘅手啊？你有冇睇見啊？
Mom, it's okay.
你有冇睇見啊？婆婆，你叫你個女要飲多啲水，唔得食煙，要瞓覺多啲，